Hello. Thanks for coming. So I'm going to switch gears a little bit from products to services today. So I'm going to tell you about my consulting company, which is called PeopleLabs. And this is my first time at 1 million cups ever. And I'm starting off with a bang and presenting. So I learned about 1 million cups from Kevin, actually. I'm super excited about this great organization. I'm actually also fairly new to Peoria. I started PeopleLabs. It's a consulting service that specializes in social, civic, and healthcare consulting. And I started it in 2004, but it was focused on products, and now it's kind of evolved in the last year to be a little more focused on services and experiences. So what we do really is creative problem solving, and we work with mission-driven organizations to help them figure out new ways to solve problems. So we're a little bit different than traditional consulting companies like a Deloitte or something. We don't go in and solve an HR problem or something, but if a company has a problem they need to be solved creatively, then we're the people to help them. So I wanted to talk a little bit about why services. In the United States and globally, we've really gone from a product-based economy to a service-based economy. And with that, people have really changed their expectations about what they want to happen. So the bar is really high for customer experience and for people to have memorable experiences. And in 2017, I put this this fact up because this is from Deloitte, and they did a large study in 2017 that showed that $13.1 trillion was devoted to services in our economy just in the United States. So there's a huge opportunity there to help improve services or to create new ones. And the most important thing in the area that I'm the most passionate about is that the feeling that people have when they use a service really impacts whether they go back there. So a lot of what we do is helping to create memorable experiences. So how many of you have gone to the DMV recently? Okay. So now, how was your experience there? Sorry. Like that. Yeah. So I put this up as like the perfect way to really talk about what PeopleLabs can do. So for me, especially as a person who's been moving all over the United States in the past few years, I've gone to multiple DMV offices to get new license plates, to get new driver's licenses, and my experience begins with just trying to find out where they're located. And that is just a huge ordeal. Like I go to the website and I have to bore through 10 pages just to find the daggone address. And then I get there and I have to wait in line, especially if I go during lunch hours, and the hours are from 8:30 to 5 when nobody is actually available and you have to take time off from work. So right then and there you're having a horrible experience. So what PeopleLabs can really do and what we're really good at is creating evaluating the organization, evaluating the system and the service, and coming up with efficiencies and coming up with better interactions and creating a more pleasant end-to-end experience. I want to take a few minutes just to tell you, I need to take a breath. I wanted to take a minute to tell you about my background and how I even got into this. Now, PeopleLabs does use a network model, so we work with a lot of freelancers and contractors depending on the project. But what I've been working in is a lot of health in the last few years, a lot of healthcare organizations that need to improve their patient experience, that need to change the patient flow, creating new cross-functional team-based collaborative models for private practices. There's a picture of an orthopedic clinic I helped design. And then a partnership I did, I think it was last year, with United Health Group to do to prevent fraud with the U.S. Postal Service. So we had postal carriers identify where doctors were listing addresses so that we could certify them to see if they were legitimate. And just through that practice alone, we helped save United Health Group about $40 million in the first 2 months because there's so much medical fraud out there. And the other thing I wanted to talk about is what kind of, how we do this. So we have, PeopleLabs has a really broad toolkit of processes and methodologies that we use. Primarily, we're design thinkers and human-centered designers and service designers, but we use a lot of quantitative and qualitative components. So obviously, we'll have data analysts, we use data analysis. We use a lot of anthropological approaches to look at how people are using services. And then in the circle, you can also see some of the value that results from working with us. That's really it about PeopleLabs. So I know that I need to tell you what it is that I can, how you tell me. So
let us ask questions first.
Kevin's my guide. All right.
Rebecca, how did you first even come upon the inkling of an idea to do this? I mean, what?
Well, I started off in product development, so I've been at this for over 15 years. So I've worked in a lot of different organizations that are using these techniques, including OSF. As the economy shifted from products to services, I just became very passionate about that, and I was asked by a couple of different organizations to help them create innovation programs or innovation garages. And so I just realized I really liked it, and then maybe just probably frustration at places like DMVs or like, well actually, now that I think about it, when I really got the bug was in about 2009, I had 5 family members that were in and out of healthcare systems, including my father. And I had worked at a Six Sigma company that used a lot of Six Sigma type processes. So I knew I loved process, but when I spent time with my dad in the hospital, I just kept looking around and thinking, wow, there's so many things I could do to make this process more pleasant for him. And I could combine kind of like the soft stuff plus the efficiency related things to make better experiences. And from then on, I focused on that.
So I love the $40 million. I hope you're working on commission. So, you know, you talked about United Healthcare, big system, U.S. Postal Service. Are those the kind of customers that you are looking for, or can you solve problems for small startups and small companies also?
I can do both, and I would say in the last, well, at United Health Group, I did a lot of work with startups and their innovation garage, and I did a lot of coaching with them to help them understand their customers, and I really liked that. So technically, I can work with startups, I can work with medium-sized businesses. I think I would actually right now really like to work with more small and medium businesses that are just starting to try to figure this stuff out, which is ultimately how can they create a memorable, great experience that will bring back repeat customers.
So tell us who your ideal customers will be.
Well, I do really, I mean, healthcare is my area, social and civic organizations. I'm very interested in government services, so what I really like are complex, very complex problems and that are systemic in nature, where I can design the end-to-end experience. So I would say government is one area, and then I would also really like to work with small private practices have a little bit of experience working with a dental practice that was a guy that was starting a quality program for dentists to help them use all the data that they get in x-rays, because no one uses that right now. And it helps create like a quality system for dentists across the country to know like how to do things. So yeah.
What brought you to Peoria?
I came here to lead the design efforts at OSF.
Okay. Did you think about this?
When did you start PeopleLabs?
In 2004, I started it, but it was more product-based, and I was doing a lot of coordination of projects and manufacturing.
Is there an idea behind the name PeopleLabs?
Yes.
Tell us about it.
So PeopleLabs it's called PeopleLabs because it's about the person being at the center of the business and trying to create better experiences for people instead of just, for instance, going after data or demographics. Yes. Either or.
Either in those experiences, are you taking the customer primarily, or are you also taking the changes that impact those employees in their workflow process?
Both. So each project is completely unique. So it could be, like I've worked on a lot of projects that were about, say, employee engagement and healthcare specifically, actually any service. You know, the way to get something to stick is to get the employees engaged. So it's almost impossible to create a fantastic customer experience if the employees don't buy into it. So there's a lot of change management that goes along with it and getting the site visits, etc.
What's been your biggest struggle in getting this off the ground?
Well, in Peoria, it's been hard because I don't know that many people. So several businesses have been suggested for me to reach out to, but I don't have any contacts. I have reached out to them, but getting a call back is another story. And then, so I built my website. I've done a tremendous amount of work in terms of the promotional elements, but then I think the other thing is just, literally just promotion, like getting the word out about that I'm here. Also changing the mindset. So I think the goal is to work with somebody that is ready to do something innovative in the first place, to change what they're doing. So finding and identifying those types of customers, especially in Peoria, has been a little challenging.
So you mentioned social service agencies we have, and usually they're in the not-for-profit
Right.
world that don't have a lot of components. So do you have a fee structure that is doable for those type of agencies?
Yeah, I mean, I do specialize in mission-driven organizations and the ones that, healthcare, social, and government are almost all like that.
I was going to say.
Yeah. Yes, I do.
A couple of the industries that you mentioned, medical and government services, have kind of a monopoly, or at least they're generating massive amounts of revenue doing the activities that they've been doing for many years. How do you come in and tell these people that are kind of bloated and very revenue profitable driven that what they're doing is wrong and you can make it better?
I won't tell them it's wrong. That's the starting point. I mean, that's been a hard lesson I've learned for sure. And I think that that's why I talk specifically about change management. That a change management element is a huge part of it, and I think another thing that can be very successful in that is by identifying whether the company has a glimmering of an interest in changing. So I really wouldn't I probably wouldn't go work with a company that was not receptive to change at all.
So,
The other thing would be to involve employees in the work, to have them be on the team. So for instance, to go out to talk to their patients or whatever, to hear it from them.
so what's been your experience in terms of large entities that you're talking about? What's been their catalyst for seeking out somebody like you?
I think the catalyst is the market right now. The shift from products to services and experiences, and just I mean, even the internet, even like digital experiences have really changed. And all the crazy businesses out there, like, well, not crazy, but like Starbucks and even Target and places that have phenomenal customer experience and create more of an experience based on your senses and something you remember. I think that's really raised the bar. So customers expect a lot, but a lot of businesses haven't realized how much customers expect now. So then they lose customers without knowing it. So for instance, I am getting ready to start a project with Blue Cross Blue Shield, and they are going to be building multiple new services that I'm going to help them kind of create. And the goal is to provide services to people in their community that can't access services, and also just simply to keep up with their competitors like Humana and United Health Group that are all doing more innovative type things. How do you acquire these clients? I got that one through word of mouth. Yeah. That's something I'm struggling with. Yeah. And there's a group of, I mean, my goal is to be kind of a leader as consulting for healthcare in the Midwest with these kinds of organizations. I realize I can't limit myself to Peoria, but this is my home. So, yeah.
Yeah,
What do you need help with?
I was gonna ask you, like, there's like Iowa City hospitals over there.
Yeah.
St. Louis, but yeah.
I just need introduction.
Those are different countries.
Sorry.
I'm signed up for your meetup group kickoff
Oh,
towards the
you are?
end of this month. Are you looking
you,
for? Yes. Are you looking for more people to
Yes.
join?
Yes. Yeah, so the thing is I spent a lot of time living in Minneapolis, and that really is a destination place for medical and healthcare. So I started the meetup, which is on March 26th, as a kickoff, because I feel like that Peoria, wants to build itself as a destination medical center, and there's so many things we can do to make that happen. And I think the idea of the meetup is to help support other startups or people who are interested in healthcare innovation, so that we really can get to being like a leader.
So is our final question to you. Considering your big challenge, what's the big hurdle that you're trying to get over right now? What is it that the people in this room can do to help you?
I would love introductions to businesses who might be receptive, or even sharing with me your perspective of this market and surrounding markets like Iowa City. I think that's the big thing.
Thank you.
Thanks, you guys.
Thank you.